Starting stream health. Cool. Let's see. Go live. Oh, I think we're on. Start recording. I think we are. Are we there? Yes, we are there. Cool. Let me see here. Good. Yes. All right. Okay. Hello, this is Bill, the Knee Pain Guru. It is Monday, January 2nd, 2017. Happy New Year to everybody out there in Hello, this is Bill, the Knee Pain on the internet, in the world. Today, we're going to talk about catching up on some questions here from wait. Let me do that. Okay. I think, let me start over. This is Bill, the Knee Pain Guru, working all the kinks out of the technology end of answering knee pain questions online in 2017. I'm great at getting people out of knee pain. The technology can be a little elusive at times. Happy New Year to everybody. And we are going to address, I got a question here from, where is it? Derek from Northridge, California. I'm recovering well from patella tendon surgery 6 months ago. I watched your video clip of walking on the knees to get rid of the scar tissue. I may have this issue in my knee. It feels a bit heavy at times when I lift it and swollen in some areas, but my PT says I have full range of motion. To free myself of the scar tissue, how long and how often should I do this technique? And do you have any other techniques I can add? Thanks for the advice. Help. Merry Christmas. Okay, well, this was a week or so old. Okay, Derek, strategy for addressing scar tissue in the knee. It's not necessarily just addressing the scar tissue in the knee. Scar tissue is also known as connective tissue or fascia that forms at the site of an injury. So you have a surgery, you have an injury, patella tendon rupture, whatever the case is, and the body will form the scar tissue as kind of like a band-aid to protect the knee. So the scar tissue is there for a reason. When you begin breaking down scar tissue, there's two ways of breaking down scar tissue. There's a direct way and an indirect way. A direct way is what most people are familiar with, which is they want to, like I demonstrate in a video, you're walking on your knees, you stick a knuckle in the area, you'll get one of those massage tools and stick it in that area to break down the scar tissue. This is going to be more like, it's going to be painful at times, so breathing is very important when doing those types of direct approaches with the knees. And that's what I demonstrate in that video. However, there's another approach. There's an indirect approach. And an indirect approach is going to be comfortable. And what I'm talking about specifically, I refer to them as pain pattern interrupts. And what happens is when scar tissue forms, you think of it like a knotted ball of yarn. And there's times when you got to like pull on that yarn to kind of get it apart. And then there's other times you got to be very specific and figure out where the end of it is and pull out that end of that string very gently, very specifically. An indirect approach, or creating comfort in the knee, is that very specific, gentle kind of approach. In doing so, what happens is this connective tissue, this scar tissue, this fascia that's kind of webbed together begins to unwind itself and begins to undo this knotted ball of yarn kind of on its own, because your nervous system has an innate intuition and knowledge and understanding on how to do this. Now, this is not to disregard the direct approach. There's some times where you can get in there and really dig a knuckle in and you can help break down the scar tissue. However, at times when the pain level is really high, we want to employ an indirect approach that will facilitate the body's healing and recovery much easier. Because when the body is in a place of comfort and it's rested and relaxed, which you create with an indirect approach, with a comfortable approach, then the speed at which the body can heal the knee, it happens much faster, much easier. So that's something that I would consider, you to look at. Now, there are a couple of programs I have on my website. You go to the kneepainguru.com. One of the programs is my Get Moving Again program. And that's more of a comprehensive, you're looking at the knee, you're looking at the hips and the lower back as well. There's also some mindset components that we get into to keep momentum moving forward. And I give specific instructions for homework. That's my Get Moving Again program. I also have an ebook called The Comfort Zone, which is focused specifically on the knee. So those two products are something that may be of use to you because they are both working with an indirect approach or working with the knee in a position of comfort to help the knee unwind and let go of the tension that it's holding on to. Of course, if you have any questions, I'm here. You could sign up for a time to speak with me on my website, thekneepainguru.com. Just book an appointment on there. We'll get on a call. We'll kind of go over your entire situation, figure out what your goal is, and then how to get you there the fastest. And if I can do it, I'll be more than happy to do so. If I could point you in a direction of someone else or something else that would be faster, I'd be happy to do that as well. So that is going to wrap up our call for today. Once again, Happy New Year to everybody. This is Bill Parravano, the Knee Pain Guru, encouraging you to have a wonderful day and a wonderful rest of the week. Thanks so much.